Start ready?
Yeah, yes.
Okay, oh, sorry. Okay, we are from Group 2. My name is Niu Sun Lin, and our group member is Joy Chu Huizi, Noor Zawani Binti Ishaq, and Fan Chao Xuan. Next. Today, we want to share about sensory impairment. The sensory impairment refers to partial or complete loss of one or more senses, such as vision, hearing, smell, taste, touch, or balance, due to damage to sensory organs or the nervous system. Next.
For the next slide, okay, I want to introduce to sensory impairment. The first one, understand the types of sensory impairment means must understand type of the sensory impairment. Got the five type sensory. Okay, first visual impairment, hearing impairment, taste and smell impairment, touch impairment, and multisensory impairment. And then second, the parents must know cause and risk factors. Means what the risk factor about sensory impairment. Means history same the pregnant they're pregnant and then they got the risk sensory impairment, and that impact on daily life. Means they cannot communicate to the another person lah. Okay, and then treatment and support means can give the counseling and mental health support, and then visual and then give the support from communication. And then the last one is a thriving with sensory impairment. And then the second part is a characteristic, reduce sensory perception, delay or altered communications, adapt behavioral responses, limited access to information, and impact on daily living skill. The last one, emotional and social effects. Okay, this one my part. And then I pass to my friends.
I say formal diagnostic criteria, delayed development or speak, watching your face and lips carefully when you're speaking. After failing to respond when called by name, and pausing after an instruction has been given, then watching other children to see what to do, speaking honestly, loudly, and correctly. Assignment 2, Wyson, Shannon, or MAR chart, result, flight testing, or image imaging, OCT, fighters, photography, hearing, code thought, ionometry, speak, audiometry, type, metry, autocasting, emission, OAE, and literary written response, ABR. Other section of factory text, accusatory text, technique, sensitivity, instruments, vestibular, balance, flotation test, flotation assignments, activities, or daily living ADL, scan, conversations, guide, invitation, test, socials.
Hi teacher, I'm Joyce. Now I'm going to
Yes.
explain the final two parts of our poster, which focus on supporting strategies in classroom, family involvement, and our references. First, classroom strategies plays an important role in helping children with sensory impairment. We suggest that providing accessible seating, clear pathway, and good lighting and noise control. Using assistive tools such as hearing aids, braille materials, tactile books, and magnifiers. And applying multisensory teaching methods like using visual aids, gestures, and sign language to help children learn through different senses: sight, hearing, touch, smell, and taste. This is called multisensory marketing, which can make learning more meaningful and engaging. Next, family involvement is very important. We recommend families to collaborate regularly with teachers and therapists, offer emotional support and find counseling resources when needed, and enroll their children early in intervention programs so they can receive support at a young age. This kind of teamwork between families and schools creates the best environment for children's development. Lastly, here are the references we use to support our research. We refer to the National Center of Special Needs Children and Families, which gives valuable information on sensory impairment and family resources. And the World Health Organization, which is WHO, guidelines, which emphasize the importance of community-based support and inclusive education for children with sensory impairments. We also included a helpful online article about what sensory impairment is, how it affects development, and how to support children with it. In conclusion, by using the right strategies in the classroom and involving families in the process, we can create a more inclusive and supportive environment for every children. Thank you for your listening, and that's all for our presentation. Thank you, teacher.